Can a daily vitamin supplement provide a subtle risk? Envision consuming an item you believe to be harmless, only to find yourself in the emergency room with significant renal impairment. A 65-year-old woman experienced this situation, and now we will examine her narrative to assist you in avoiding a similar mistake. In December 2012, a 55-year-old woman with a kidney problem was brought to the emergency room. She exhibited significant weakness, low heart rate, severe edema, and a critically low body temperature of 93 degrees Fahrenheit. Concerned about the deterioration of her renal function, physicians assessed her creatinine levels. The findings were alarming. Her serum creatinine levels had escalated to 3,530 milligrams per deciliter, a significant rise from merely 2 months prior. This signified that her kidneys were rapidly deteriorating. She wasn't producing urine, and her body was saturated with toxins. She was transferred to the intensive care unit and commenced dialysis without delay. The medical team was baffled by how quickly her renal function had decreased. After many investigations, they uncovered the surprising cause: a popular vitamin pill. This vitamin, commonly consumed every day by many individuals, proved to be exceedingly detrimental to her health. It serves as a reminder that over-the-counter supplements may occasionally pose greater risks than prescription medications. Specifically, there are 5 vitamins that can be very hazardous if not utilized correctly, especially for persons with kidney disease. Avoiding all vitamins isn't the solution either, as they might be necessary for health, but it's vital to be careful about which vitamins you consume. This woman's experience is part of a bigger pattern of hospitalizations due to incorrect vitamin consumption. Not long ago, a TikTok influencer suffered kidney stones after taking vitamins to improve her immune system. Earlier in the year, a 61-year-old man developed significant discomfort, initially considered to be pancreatitis, but later related to his vitamin pills. Another example had a patient who experienced continual vomiting, severe leg cramps, and significant weight loss of 28 pounds after a month of taking too many vitamins, which led to renal damage. These personal experiences show the importance to be knowledgeable about the supplements you consume. It's crucial to know the correct dosages and the risks involved. People with kidney problems are especially vulnerable since their kidneys can't adequately get rid of excess vitamins, leading to a harmful buildup. Understanding the right usage of vitamin supplements is vital, especially for people with kidney difficulties. By being aware of these hazards and controlling supplement usage carefully, you can avoid significant health complications and protect your kidneys. If you're a regular reader, you already know the significance of being cautious with supplements, especially vitamins. Today, we'll look at 5 vitamins that have hidden concerns. Some can be hazardous if taken in the improper form or dosage, while others offer a risk exclusively to those with renal illness. It's crucial to treat these vitamins with care. In summary, while vitamins are vital, they can be hazardous if not utilized carefully. Always contact with a healthcare provider before starting any new supplement, especially if you have an existing health issue like renal disease. Stay informed, use vitamins properly, and preserve your health. We'll start with the least risky and advance to those with more serious dangers. Number 5 is vitamin D, which is vital for kidney function. I often talk about its benefits, but it's vital to monitor how much you take. Vitamin D is fat-soluble, so too much can build up in your body and create problems like high phosphate and calcium levels. These abnormalities can lead to significant complications such as arterial calcification and, in certain situations, acute kidney damage. To avoid these hazards, it's advisable to take vitamin D in moderation. A safe dose is normally about 2,000 IU per day, along with 100 milligrams of vitamin K2 and magnesium. This combination helps avoid artery calcification and maintains acceptable vitamin D levels. If you know someone with chronic kidney disease, providing this information could be very beneficial. Also, don't forget to like and subscribe. It's surprising to realize that vitamins we need can be hazardous, but being aware is better than coping with kidney failure. Understanding these dangers helps you protect your kidney health efficiently. There's also another vitamin that needs careful handling, especially in its synthetic form, as it can be dangerous. Number 4. On our list of troubling vitamins is cyanocobalamin, the synthetic form of vitamin B12. Unlike the natural form, methylcobalamin, cyanocobalamin is synthesized because it's cheaper. This synthetic form is contained in several multivitamins, making it widely utilized. However, it can pose considerable dangers, especially for patients with chronic kidney disease, CKD. Cyanocobalamin contains tiny levels of cyanide, as its name suggests. While healthy persons may process and eliminate these traces without difficulties, patients with CKD have lower kidney function, making it harder to clear cyanide. This can lead to a toxic accumulation and aggravate kidney disease. Studies have indicated that large dosages of cyanocobalamin can produce minor levels of cyanide, which can severely affect patients with CKD. Therefore, patients with kidney difficulties should choose for methylcobalamin instead. This natural form of vitamin B12 is safer for those with limited kidney function and is normally suggested in a dose of 6 micrograms daily, especially for those on a plant-based diet. Vitamin B12 in its synthetic form is poorly absorbed. Thus, manufacturers often put huge doses of cyanocobalamin in supplements, sometimes 100 times the recommended daily intake, RDI. This is supposed to guarantee sufficient absorption but can raise the danger of cyanide accumulation in persons with kidney difficulties. For those on a kidney diet, adding vitamin B12 is necessary to avoid deficiency, which can lead to major health complications like vascular disease and anemia. However, choosing the proper form and dosage is vital for safety. Regular vitamin B12 shortage can create serious health problems. Thus, supplementing is required, but it must be done carefully. People with CKD should check their supplement labels to verify they are receiving methylcobalamin, not cyanocobalamin. This manner, individuals can avoid the hazards connected with cyanide while still benefiting from vitamin B12, which is needed for overall health. Continuing our countdown, the third post discusses a regularly taken vitamin that can cause major health hazards. Studies have connected this common vitamin to many detrimental effects, including elevated blood pressure, higher risk of stroke and cancer, bone loss, higher cholesterol levels, and even kidney damage. Despite these hazards, it is nevertheless frequently produced and used in many products. Avoid alpha tocopherol, the synthetic version of vitamin E. If you watch this channel regularly, you know I constantly warn against using vitamin E pills if you have kidney disease. The concern with alpha tocopherol is its extensive presence in the market. It's present in supplements, vitamin powders, drinks, and food items. For those with kidney disease, the risk from this synthetic vitamin is extremely high. However, natural vitamin E can be advantageous. It's a powerful antioxidant, and antioxidants are important for monitoring and treating kidney disease. Even so, I strongly suggest avoiding using vitamin E supplements unless prescribed by your healthcare provider, particularly the synthetic kinds. To securely absorb vitamin E, it's recommended to rely on food sources. For example, sunflower seeds are an excellent option. Just 1 ounce of these seeds can deliver up to 66% of your daily vitamin E needs, demonstrating their usefulness in a balanced diet. While natural vitamin E has its benefits, the synthetic form, alpha tocopherol, poses considerable hazards and should be avoided. Be cautious with any supplements that contain large dosages of this synthetic substance. Always consult a healthcare practitioner before adding any type of vitamin E to your regimen, especially if you have underlying health concerns like kidney disease. In summary, while natural vitamin E is good, manufactured vitamin E, alpha tocopherol, is dangerous, particularly for persons with kidney difficulties. Stick to natural dietary sources for vitamin E and consult your doctor before taking supplements. Vitamin A gets the second rank on our list for its possible risks, even more than synthetic vitamin E, especially for kidney health. While vitamin A is normally good, large quantities might be dangerous, particularly for persons with chronic kidney disease, CKD. People with CKD should avoid typical multivitamins that include vitamin A, such as popular brands like Centrum, Smarty Pants, or Superdin. The difficulty is that damaged kidneys can't efficiently filter and eliminate excess vitamin A, leading to a buildup that can become poisonous. This can cause significant health concerns, including liver damage, birth abnormalities, and decreasing kidney function. Vitamin A toxicity is commonly associated to eating too much of specific foods, such fish liver. While it's unusual, overindulgence in certain meals might induce severe kidney injury, leading to hospitalization. This highlights how harmful high quantities of vitamin A may be, even from natural sources. Additionally, the quantities of vitamin A in conventional multivitamins can be dangerous for those with impaired kidney function, which is frequent in CKD patients. Because vitamin A can build in the body, it's vital for persons with kidney troubles to monitor their intake carefully to prevent toxicity and further kidney damage. In summary, while vitamin A is vital for health, its intake must be carefully controlled, especially in patients with kidney impairment. Excessive vitamin A can lead to major health complications and hasten kidney damage. Taking the number spot on our list is vitamin C. Let's look at the serious example of a 55-year-old woman who sustained catastrophic kidney damage, exposing a critical health risk associated to this ubiquitous supplement. Her health crisis was precipitated by vitamin C, a supplement many people use frequently for its health benefits. She took various pills every day, including calcium, digestive enzymes, cranberry, a multivitamin, vitamin D, and especially vitamin C. While all these supplements were part of her health routine, only one led to her quick health decline. Doctors were originally confused by her dramatically decreasing kidney function. The breakthrough occurred when a comprehensive kidney biopsy revealed a substantial concentration of oxalate crystals, a disease associated to high vitamin C intake. Her daily intake of 1,000 milligrams of ascorbic acid, a standard quantity for increasing immunity, turned out to be a nightmare for her compromised kidneys. Vitamin C is frequently recognized for its antioxidant effects, supporting the immune system and assisting with iron absorption. However, in her situation, the large dose was hazardous since her body couldn't digest and discard the excess adequately. This case teaches us an essential lesson: the significance of limiting vitamin intake, especially for people with pre-existing health concerns. In summary, while vitamin C is useful, it can be dangerous in high levels, particularly for persons with kidney difficulties. Always speak with a healthcare provider before using supplements and watch for any unusual symptoms to protect your health.